Hello and welcome, ladies and gentlemen, to our special coverage on the escalating tensions in Lebanon. I'm Hani Saif. As Israeli airstrikes continue to target areas across the country, Lebanon faces a dual crisis. Relentless bombardments impacting civilian life and the healthcare system on the brink of collapse. With nearly one-third of health facilities shut down, essential medical services are severely strained and thousands are being forced to seek refuge in overcrowded shelters or flee across borders.
كل المستهدفين هن مدنيين.
وضع شيء مرعب، شيء بخوف.
An Israeli strike early this morning has killed at least 3 journalists and injured several others while they were sleeping in guest houses designated for media workers in Hasbaya, southern Lebanon. The strikes mark the deadliest day for media workers in a year of hostilities between Israeli occupation forces and Hezbollah. 5 journalists had been killed in previous Israeli strikes in Lebanon during the conflict. Lebanese Information Minister Ziad Makari has condemned the Israeli strike on journalists in Hasbaya as a war crime. Makari accused Israel of deliberately targeting journalists, leading to the deaths of 3 media personnel after surveillance and tracking. Lebanon's caretaker Prime Minister Najib Mikati has condemned the recent Israeli assaults targeting journalists and reporters in Hasbaya, south of Lebanon. Mikati described the attack as a chapter in the ongoing war crimes committed by Israel without international deterrence or response. He also stated that he has directed the Ministry of Foreign Affairs and Immigrants to add this latest crime to the documented files of Israeli crimes that will be submitted to the appropriate international authorities. Egypt's media giant United Media Services has extended its wishes for the safety of Al Qahira News crew in Lebanon after a cameraman was injured in an Israeli airstrike on the journalist's residence in Hasbaya, southern Lebanon. The media company affirmed its ongoing support for Al Qahira News teams in Lebanon, Palestine and conflict zones worldwide, ensuring comprehensive and credible coverage. And we're joined now by Mr. Khalid Dawood, the Assistant Editor-in-Chief of Al-Ahram Weekly, to shed light on the realities and challenges that journalists encounter on the ground. Mr. Dawood, thank you for joining us here on Q News. Now, this morning's tragic incident has added the rising toll on journalists in this conflict. Can you start by sharing your perspective on the dangers media workers face in the conflict zones, especially in Lebanon, on a daily basis?
Well, I think, first of all, thanks for having me. But I think that the suffering of the media workers have basically been going on since the beginning of the Israeli aggression against the Palestinian people in Gaza more than a year ago. And of course, the key target and aim is to hide the truth, hide the war crimes that are being committed by the Israeli occupation forces, first of all, over the past year in different parts of Gaza, and over the past month right now, in Lebanon, and the latest sad incident, of course, is the very determined targeting of headquarters, which media journalists are using in Lebanon to cover the ongoing war. But also, let me remind you, actually, that the first journalist victim of the Israeli aggression war more than a year ago was actually on the border between Israel and Lebanon when the Israelis intentionally shelled a vehicle carrying a number of journalists, resulting in the death of a Reuters journalist. And all indications was that Israel committed this crime intentionally. So, I mean, it started in Lebanon, actually, and it kept on going on in Lebanon. But according to all in the media groups and all the NGOs that follow the violations of the Israeli the army inside the occupied territories in Lebanon, they note very much that the number of journalists who died in this conflict is unprecedented compared to any other war, probably since World War II. I mean, over the past year, you have over 170 Palestinian journalists killed. And actually, what adds to the violations that the Israelis are committing, particularly in Gaza, that the Israeli occupation troops have not only been targeting journalists themselves, but also their family members, as we have seen early on in the war, against the families of journalists who work for Al Jazeera and other the Palestinian media channels. Some of our fellow journalists have lost all their entire families. And of course, it's, I guess, one of the most difficult moments for any journalist in the world to be reporting on a certain incident and then later to discover that his family, his father, mother, or children have been killed themselves in the war. So probably what happened this morning or early this morning in Lebanon is a continuation of a consistent Israeli policy that's aimed at steering journalists away and not allowing them to cover the conflict, putting in mind, of course, that the Israeli occupation forces have prevented any international journalists from entering the occupied Gaza Strip since the beginning of this war. So on one hand, no foreign journalists are allowed into Gaza, and at the same time, nearly daily killings of the Palestinian journalists themselves working on the occupied territories.
Well, in light of Israel's recent attacks on the media-designated spaces and houses and safe and guest houses, now, including the strikes in Hasbea, you've mentioned that it is an intentional strategy to silence or deter reporting in conflict areas. Now, is there a certain reason or a strategy that they are actually following? Are they targeting certain journalists or press personnel in specific?
Well, of course, the key purpose is that they want zero coverage coming out of the occupied Palestinian territories, considering the humongous amount of destruction and the horrific numbers of those who got killed in the Palestinian territories, both in Gaza, of course, that's the top number, nearly 40,000 people right now, and of course, and also in the West Bank, which wasn't spared this Israeli violence. And we have over 700 Palestinians who have been killed in the West Bank over the past year. So that's basically the main purpose, to hide the crimes that the Israelis are committing in the occupied territories, especially when it comes to certain channels that are known for their extensive coverage of the Palestinian cause, noting, of course, particularly the Jazeera channel that has been actually top the list of the channels that lost members of their staff during the coverage of this war. And that's why, I mean, there's been this accusations by nearly all NGOs and all organizations covering media worldwide that the Israelis have been imposing the worst blockade journalists have ever seen in the history of coverage of wars. Even the only thing that's allowed actually is when the Israelis embed reporters based in Israel and take them along to the occupied Palestinian territories to check what the Israelis want them to see. But of course, that would be very biased coverage, and they never produce the objective and balanced coverage that the audience deserves to see.
Mr. Dawood, now today really marks one of the deadliest days for journalists in a year of hostilities. Now, how does this continued violence against the press and media personnel impact the ability to document and report events accurately in conflict zones? I mean, and how are the media institutions and agencies trying to make up for the injured and those who lost their lives?
Well, I mean, again, the dependence is totally on the local staffers, the Palestinian local staffers who work inside Gaza, considering the bans and the restrictions that the Israelis have imposed on any other kinds of journalists working in the occupied territories. But of course, it's a very scary business. Our job as journalists is mainly to cover the events without getting our lives jeopardized. I mean, we're doing a professional job where they're not taking any side on those, kinds of daily conflicts that are taking place in Palestine. So, I mean, by law and according to international conventions, journalists should be provided with protection while carrying out their jobs. But on top of that, we have also seen the Israelis closing down the media offices of some media companies such as Al Jazeera, and even it went to, at one point even against international news agencies, who are now one of the key sources to provide at least pictures and information out of the occupied Palestinian territories. But again, we should all salute the resilience and the courage of the Palestinian reporters working inside Gaza and inside the West Bank for all the sacrifice that they've been offering for this job. And the fact that, I mean, I can never forget that whenever any journalist lose a member of their family or one of their colleagues, the first thing they say is that they will continue their mission despite all the difficulties, because they are the only eyes that through which the world can see the atrocities which the Israelis are committed, and they're playing a very, very important role, at least in the future, for the documentation of those crimes and the fact that they could be presented later to the International Criminal Court, which Prosecutor General has issued arrest warrants against the Israeli Prime Minister and his Defense Minister, Yoav Gallant.
Well, journalists and press and media personnel join a long list of also other medical personnel and NGO workers, as you've mentioned. Do you believe that there are enough measures in place by international bodies to protect at least journalists, or is there more that should or could be done?
Well, unfortunately, I mean, the experience, the bitter experience of the past year proved that Israel doesn't bow to any pressure, because they've been committing all sorts of, unbelievable, unimaginable crimes, not just against journalists, but against health workers, rescue workers. I mean, people who work in the UN. Lately, even the engineers who are seeking to fix water facilities inside Gaza Strip. So again, unfortunately, the death of that huge number of journalists is part of the general suffering of the Palestinian people and the indifference of the world, despite all the big slogans that are being raised by Western democracies and including the United States and European nations that claim to champion freedom of expression worldwide. But when it comes to the Palestinian suffering, we see no real action. First of all, to provide protection to the Palestinian civilians who've been seeing a nightmare lately in northern part of Gaza due to the siege and intentional starvation policy. So, Palestinians, journalists are part of the overall Palestinian people who are paying a heavy price, not just for the Israeli aggression, but for the world indifference and the hypocrisy of Western nations, topped with the United States, that provide Israel with all the weapons that are killing Palestinians and killing journalists too.
Mr. Khalid Dawood, the Assistant Editor-in-Chief of Al-Ahram Weekly, thank you very much for sharing your insights with us today. And the Israeli warplanes have continued bombing various areas across Lebanon, intensifying their strikes on Beirut's southern suburb. Lebanese media reports that the suburb experienced approximately 12 airstrikes during the night. WHO Director General Tedros Adhanom has announced that the conflict in Lebanon has forced over 100 health facilities, approximately one-third of the country's total, to shut down. The WHO urged an end to attacks on healthcare facilities in Lebanon, citing Israel's ongoing airstrikes over the past 3 weeks. WHO's representative in Lebanon, Abdel Nasser Abu Bakr, has reported that medical facilities in southern Lebanon have been severely damaged. He added that 10 hospitals are now unable to provide essential medical services, stressing the urgent need for a ceasefire and international support to restore healthcare services. Meanwhile, UN peacekeeping forces in Lebanon, UNIFIL, have warned of the deteriorating situation along the border due to Israeli military operations. UNIFIL stated that there are no signs of de-escalation in the clashes between Israeli occupation forces and Hezbollah. The United Nations High Commissioner for Refugees has reported that government shelters in Lebanon are now overcrowded. The agency added that around 430,000 people have fled from Lebanon to Syria. noting that Lebanese citizens are crossing into towns still suffering from a 13-year-long war. We're now joined by Dr. Hisham Fawaz, head of the Hospitals Department at the Lebanese Ministry of Health, to discuss the alarming state of Lebanon's healthcare system amidst relentless airstrikes and rising violence. Dr. Fawaz, thank you very much for joining us. Lebanon's healthcare system has been severely impacted by the recent airstrikes. Now, can you give us a sense of how these attacks have affected hospitals and healthcare providers across the whole country?
Yes, thank you so much. Good evening, everyone. I will present some numbers for the public just to know what we are suffering. First of all, we reported around 268 attacks on the health facilities between hospitals, primary healthcare centers, and EMS teams or emergency medical teams. We have 163 deaths. We have 262 injuries. We lost around 158 hospital. We lost 158 ambulance. We lost around 37 fire trucks, 15 rescue vehicles. All these big numbers are the attacks reported on the healthcare system, which is not acceptable by all means, which against Geneva Agreement, which against all international agreement, UN laws. Israeli army are not respecting any international law, are not respecting any international agreement. They are attacking journalists, they are attacking hospitals, they are attacking EMS teams, which again is putting a lot of pressure on our health system, because till now we lost already 8 hospitals totally out of service. 7 hospitals are working partially, which means around 15 hospitals which are out of the system, which is putting additional stress and additional pressure on the other hospitals, on the other governorates.
Mm-hmm. Dr. Fawaz, now with 268 attacks, as you've mentioned, and 163 lives lost in the health and hospital sectors alone. Now, how's the Ministry of Health coping with all the loss or in the human toll of this crisis on the healthcare workers?
For sure, we are really sad for such numbers. For sure, our healthcare system is suffering. The situation is very critical. It's very dangerous, because day after day, the attacks are continuing, are growing, which is putting the whole system on a high risk. Till now, we are managing by transferring patients and injuries between hospitals from front lines to Beirut and Mount Lebanon. We are trying to make always, or to have the balance in the system. Also, we are evacuating sometimes some patients from areas to another areas. But again, we are suffering, the AMS teams are suffering, sometimes are not being able to evacuate injuries. Yani, sorry to tell you, but till now, since 10 days, we have 8 medical team, 8 members from EMS teams with 3 ambulances. They are still in their ambulance deaths. Israeli army are not allowing to ICRC or to Lebanese Red Cross to evacuate the 8 EMS martyrs. Yani, we have healthcare workers that are died by attacks, and we are not allowed to evacuate them even since 10 days. So here you can see how much Israel are not respecting any law, are not respecting any UN law, let's say. Even though the situation is still under control, we are still being able to manage. Why we are managing? Because already we prepared our system since 1 year. Lebanon health system is already a strong system, but for sure our capacity is decreasing day after day. The pressure is increasing day after day. If these attacks will continue, if we will continue losing hospitals out of system, that will create a big problem in the near future.
And with the transfer of patients from one hospital to another or from one clinic to another, and as you've mentioned, a lot of ambulances have been destroyed, are they having any safe and secure transport route? Are you setting up hospitals within the fields?
Sorry, there is no secure any transportation. Our EMS teams, our medical healthcare workers are heroes, to be very honest, because they are not taking any guarantees, any security from anyone. And sorry to say that, even Lebanese Red Cross, many times they take the green light or the deconfliction light, which is known between UN. But even after taking the deconfliction and taking the approval by the Israeli side, they are being attacked. Yani they give the approval when the LRC or the team is going to evacuate someone. Many times they were attacked, and also that's give you a full picture with who we are dealing with, an enemy who is not respecting even his words.
Dr. Fawaz, now, are you receiving any sort of help or assistance from the WHO, from other international health organizations during these difficult times in Lebanon?
Yes, we are receiving already. We received around 100 weapon wounded kids from WHO and UNHCR together. We are receiving support from UNICEF. We are receiving support from Egypt, and here I would like to thank Egypt. We are receiving support from UAE, KSA, Kingdom of Saudi Arabia, and from Qatar also, from Turkey, from France. We appreciate any support that we are receiving. We highly appreciate all the support that we are receiving. But I believe Lebanese people, the real support that they need in this moment is a ceasefire. A ceasefire today before tomorrow.
What about the medical supplies? Do you have enough medicine? Do you have enough portable and mobile ICU units? Are you having enough oxygen tanks? Are you having enough gas for the hospitals and the makeshift clinics?
As I mentioned before, to be very honest, the situation is very critical, but still under control. We didn't lose control. For sure, we have deficiency in some medication. We are requesting from our partners, from the countries that are willing to support our needs. We have also deficiency in the chronic medication. We don't want to forget the health needs for the displaced. We have around 1.2 million displaced people inside Lebanon. 25% of Lebanese population are now displaced. These displaced people have a lot of medical and health needs, especially chronic and acute medication. Already, as Minister of Public Health, we distributed around 2 million packs of medication between acute and chronic medication, but the need is still there. Don't forget, these people need medication on monthly basis, some on weekly basis. For sure, we have.
Dr. Hisham Fawaz, head of the hospitals department at the Lebanese Ministry of Health, thank you very much, sir, for joining us here on Q News. And by this, we come to the end of our special coverage over the situation in Lebanon. But please don't forget to follow Q News on YouTube, Facebook, X, Instagram and TikTok at Q News EG to stay informed. And for real-time updates, connect with us on the UMS digital platform. Watch it. I'm Henny Safe. Thank you for joining us.